I'm thrilled to introduce this panel today. We have three scholars from Quinnipiac, all talking about the topic of health, healing, and spirituality. This is the third in our series of panels this semester. We've had interesting and stimulating conversations, so we are hoping that this will stimulate you as well. Basically how this works is, again, we have three speakers today. Each will present for about 20 minutes, and then we will open it up for question and discussion. So I'm going to give a brief introduction to the speakers, and then they will each present in this order. Our first speaker is Cynthia Barrere, who is a professor of nursing and the director of faculty development in the School of Nursing here at Quinnipiac. Cynthia earned her PhD in medical sociology from the University of Connecticut. She is board certified as an advanced holistic nurse and has published widely. Our second speaker is Anna-leila Williams, who is an assistant professor of medical sciences in the School of Medicine. Over the course of her career, she has developed expertise in the socio-behavioral factors that influence health. Her areas of research have included complementary and alternative therapies, palliative and end-of-life care, and the role of family caregivers. And our third speaker is Tami Reilly, who is the Associate Athletic Director of Fitness and Wellness here at Quinnipiac. She's been instrumental in bringing a variety of programs related to health, healing, and spirituality to the Quinnipiac community. So welcome, and Cynthia, you will start us off.
Thank you. Well, welcome. I'm going to share with you a little bit about my journey from a research perspective that started with a colleague of mine. And as you can see from this slide, you're thinking, oh, I missed her presentation, because I have up in front of me the selected references, which usually come at the end. The reason I placed them here is to share with you just briefly where this journey began. A colleague of mine, Colleen Delaney, of faculty at UConn, developed a spirituality scale. She was interested in how one could actually quantify this particular topic. It isn't easy. It's more conducive to qualitative research than quantitative research. For her dissertation, she did develop this scale that has been widely used, not just nationally, but internationally as well. It has been also interpreted in different languages across the world, which is really exciting for her and for me as well now that I've joined her in this journey. The scale has 23 items. It is understandable, usable, and we have been trying it in our own research. The second, I'm kind of going from the bottom up, that was in 2005. In 2008, she invited me to join her as we then used her scale to see if we could actually use or examine an intervention. As nurses, in practice, as part of a health assessment is assessing someone's spirituality. Well, how do you do that? And then if you are able to do that, what kind of interventions do you share with individuals to then do if they need an intervention? How do you determine they need an intervention? So we conducted our first small pilot study, and we looked at, and this one up here, 2008, that is identified on there, Blessings, the influence of a spirituality-based intervention on psychospiritual outcomes in cardiac population. We both had an interest in cardiovascular disease. And it did give a preliminary evidence that anxiety is reduced as spirituality is enhanced. We then conducted a study, the next one that you can see on the list, in 2009, Eco-Spirituality, the experience of environmental meditation in patients with cardiovascular disease. And that was a very interesting study as well, where we used Kalasi's method of interviewing individuals with cardiac disease and learned more about their experiences regarding spirituality. The one I'm going to share with you now is the third and most recent. We published in 2010 and invited a third colleague. Some of you probably know her, Mary Helmy. She also works with me in the School of Nursing. And the three of us, a little larger study, but still a pre-experimental pilot study, we again looked at interventions. We tried to improve some of the things we found with the first study, some problematic things. For example, in the first study, the intervention, and I'll show you a little bit more later, was a musical CD, a spiritual CD with a beautiful musical background. and the woman who spoke brings the individual through a meditative experience. It's quite lovely, and I do have the CD here if anyone is interested in seeing it afterwards. However, we did learn that there are individuals with hearing impairments. And what would happen is when they listened to the CD, we discovered they really couldn't distinguish all the words because the music sometimes overtook what the woman was saying on the CD. So then in our subsequent study, we had a separate CD made that subdued the music so the voice could be heard more clearly. So that's why pilot studies are important, because they do show some practical kinds of things that need to be addressed in the future or more larger study later on. So the one I'll just share with you right now is the most recent study, the one published a few years ago, The Influence of Spirituality-Based Intervention on Quality of Life, Depression, and Anxiety in Community-Dwelling Adults with Cardiovascular Disease. So spirituality is emerging as an important aspect of patient assessment, but really not clear what, as I mentioned before, what do you really do with that information? How do you evaluate it? What kind of interventions might be useful to individuals? We looked in the literature and determined that the literature did share that cardiac patients with high levels of spirituality did have better outcomes in regards to fewer cardiac events, readmissions to the hospital. Some of this work, this preliminary work, is there in the literature. So we thought we would capitalize on that and continue with our interest in the cardiac patient population. Also, the literature shares with us that spirituality is associated closely with quality of life. The specific aims of our study were to determine a preliminary effectiveness of spirituality-based intervention on health-related outcomes in persons with cardiovascular disease. Also, to determine the feasibility of a spirituality-based intervention based on patient satisfaction. What did they feel about the intervention that we instructed them on prior to discharge or instructed them on in the home setting? We used Watson's theory of caring. It seemed to really fit with what we were looking at. And she does also provide more credence to the fact that spirituality, it's definitely involved with an organized religion. Also, if everyone is a spiritual being in terms of what gives you meaning to your life. So in the study, you have to operationalize exactly what is spirituality, and there is, of course, a challenge. What we did is, because Colleen happened to have this wonderful spirituality scale, that is how we operationalized what spirituality was actually her scale itself. And I'll just read you some of the questions on the scale to give you an idea of a few of the 23 items. I find meaning in my life experiences. I have a sense of purpose. I am happy about the person I have become. I see the sacredness of everyday life. I believe that all living creatures deserve respect, and I live in harmony with nature. So those are a few of the questions, but they're questions that people can typically identify with and easily answer on a Likert scale or 1 to 5 scale. Then the scale would be scored, and those that were below, and there were 3 subscales that were below a certain level on a subscale, were then provided that would activate the intervention. And I'll show you the intervention shortly. But the 3 subscales are up on the screen in front of you. Self-discovery, or learning and appreciating yourself. Relationships with others, so it's a relationship with yourself, relationship with others, perhaps that's where some healing is needed. Or eco-awareness, or appreciation of the environment. The methodology we used was a pre-experimental design, so another pilot study before a larger one that we do hope to do at some point. The independent variable was spirituality. It was a based intervention that included meditative interventions, 3 specific meditative interventions that are in alignment with the 3 subscales. And then also we use the CD that I was sharing with you is a musical CD. It's also a meditative experience, and it addresses, as you listen to the music, and it brings you through thinking about yourself, your relationship with others, and healing those relationships and appreciating the environment around you. The dependent variables were quality of life, depression, and anxiety. And we use appropriate, reliable, and valid tools like the CDS depression scale, the state trait anxiety scale, and a quality of life scale. There is one specific to cardiovascular disease. The research questions were: 1, what is the effect of spirituality-based intervention on quality of life, depression, and anxiety in patients with cardiovascular disease? The second, what is the feasibility of patients implementing a spirituality-based intervention? So as you see, there's a lot of areas to address. It's measuring spirituality, having an intervention that you can teach to an individual, and then hopefully the individual will use the intervention once they leave the hospital, or if you're looking at the home setting. In this particular situation, we were more looking at the outpatients. Will they use it and practice the intervention? This is an example of the 3 different meditations that we shared or taught to the individual. If someone was needing to enhance their self-discovery aspect of spirituality based on the scale, then we taught them this mindfulness meditation intervention. And you can see that they all look similar, but this one focuses on, as you look into number 4, as you observe, you have the person, of course, sit quietly and become meditative, quiet, relax, and inhale, take a deep breath in and a deep breath out. So they begin the same. Then number 4, as you observe your breath, you may notice it changing. There may be variations in speed, rhythm, or depth of your breathing may even seem to stop for a moment. Again, merely observe all this without trying to influence any changes. You may find your attention drifting away from breathing now and then. If this occurs, gently return your attention to your breath. So you keep refocusing yourself back within. And then after approximately 15 minutes, you awaken back up again. Not that you would have been sleeping, but come out of the meditative, relaxed state. The relationship intervention activated the heart touch technique meditation. So you can see that it looks similar, but on here, the 4th one says, imagine a small circle of light in the center of your forehead and watch it move slowly down your face, neck, chest, and see it come to rest in the area of your heart. Allow the circle to grow in size with it until the sphere is encircling the entire chest. Recall a situation where you felt very loved, or where you felt very loving toward another individual, whether person, animal, plant, or place. Send the feeling of love that you are feeling to an individual by imagining the love as a stream of light moving from your heart area to the heart area of the other individual. And then see the light and the love filling and surrounding the other individual. The 3rd intervention for those who needed some uplifting in the 3rd scale, or 3rd category of the subscale, was the eco-awareness aspect. And here we were recommending prayer or silent reflection in a healing environment. And the environment could be outside. Not everyone lives in an area that's wooded or has a yard, so it could be a favorite place in an apartment or a home, wherever the individual chose. And they would sit quietly and just take in the beauty and appreciate what was around them. So each of these had a specific purpose. Before I move on, some things, again, you'll learn from a pilot study is, first, what is the dose? If a physician or a nurse practitioner here take this medication twice a day, this many milligrams, okay, well, how often do you tell or do you instruct someone to meditate? It's not really written anywhere. So what we determined is that the CD would be played once a week, and the specific intervention for meditation would be 3 times a week. Now, at week 2, we called all of the participants in the study and asked them how it was going. Were they actually doing what we suggested? And some were, some weren't. Some had excuses, and some really loved it. A variety of reactions. But that was an interesting concept, is looking at the dose of the meditation. Well, the other piece also that I want to share with you that was rather comical, that we learned from this one, that the participants taught us. There were 3 subscales, as I've mentioned, and if a participant was low in one or more of the subscales, that would activate a particular intervention, whether it be eco-spirituality or the looking at themselves or the relationships. Some individuals, which we hadn't thought about until after we got into the study, and it's a good thing it was a pilot, what if someone was low in 2 or 3 areas? So here we are giving them 3 or 2 meditations and thinking, okay, this is a little much. What actually happened at the end is people self-selected to do the meditation that actually met with their lowest subscale, which is quite interesting. So in the largest study, if we actually are able to acquire funding and move on to something much larger, we have fixed all of these little things that came out. One of which is what we would do in the largest study is identify the meditative intervention that would fit with that individual's lowest subscale, instead of trying to fix everything all at once. It does make sense, but they taught us. And this is the picture of the cover of the CD that we have specifically made. Suzanne Jonas is a musical psychologist. She does beautiful meditative musical songs, and she did a beautiful meditation for us that did address spirituality, and it walks you through a beautiful garden. It helps you to think about your relationships with others, think about yourself. It's really very nicely done. So we did use that. It does help facilitate relaxation and helps to improve somewhat, or at least it gives, these are pilot studies, so they're not perfect, but it does show that there is promise to some of these meditative interventions that we were using. The sample and setting, we worked with individuals in the cardiac rehab units in 3 hospitals and a multi-branch home care agency. We had 41 patients enrolled, and I believe 27 completed the study. The results, well, the primary outcome of quality of life, we used a repeated measures analysis and it did reveal that participants who completed the 1-month study, was we did a pre and a post of all of the scales that we used, did demonstrate significant increase in quality of life. In specifics, it increased health and functioning and the psychological spiritual subscale, which we were happy that it did those 2, because you might expect, well, health and functioning perhaps, especially if they were in cardiac rehab, they're probably going to be feeling better maybe a month later. But it also then helped with the psychological spiritual subscale as well. Again, not demonstrating that this is the way to go, but it's worth continuing to investigate on a larger scale. This gives you a pictorial graph of the areas that were significant. The secondary outcomes, depression, it really didn't show any difference. This particular population or sample of patients were not depressed. That's a good thing. So it didn't really show that they were less depressed since they weren't depressed in the first place. Also, anxiety. It wasn't a particularly anxious sample of individuals, so that wasn't improved because there was nothing really to improve. Spirituality, however, was significantly improved a month later. So in looking at feasibility, we spoke with the patients at the 2nd week just to get a feel for were you doing it, what were the problems, what were the issues. And there were some individuals who were, well, it was just too much time, they really wanted to do it. But there were those 27 who did hang in there the entire month, and they really did do it and enjoyed the experience. And what I've learned about meditation, I have some colleagues coming up, I don't know if they would agree or not with this, but meditation isn't something that I ever actually did either. I was more into active exercise or yoga, and what I've learned is that I meditate now when I'm doing certain yoga stances. It's something that has to be practiced, like anything, when you're learning any kind of a skill. And once you do it repeatedly, all of a sudden you have that feeling of peace from within, that it does actually come, but you have to practice it. And some of the participants in the study, it did work for them, and others it did not. And that's what we would expect. Let's see. The discussion then, we determined that the study findings do support further research in this area. They can't be 100% conclusive since they were a very small group at both pilots, but it is an area worth further investigation. We do have a larger study. It is almost ready to go if we decide that we have the time and energy to go through with it, and we are excited about it, and hopefully we will have received the funding, granted the funding to continue on further investigation into this area. Thank you.
So thank you everyone for being here this afternoon. You may notice that this is a different title than what was advertised. So what happened was when I went to set up my presentation on barriers to meditation, I realized that it was largely a psychometric study. There were lots of numbers all over these slides, and I thought that given the opportunity to have a microphone and an audience, that it might be not only more interesting but more valuable for us to hear from people at the end of their life talk about spirituality. And so that's a different study that I did, and that's what we're going to talk about today. So let me just tell you about the genesis of this study. This might be interesting to folks who are either students or early in their careers, because I did this study with zero funding. It was just something that came to my mind. So what happened was there's lots of initiatives on the national level to improve end-of-life care in the United States. These were big projects with thousands of patients. And what came out of them was very important information about how to improve medical, social, and emotional issues for people who are at end of life and their families. What was neglected largely was the spiritual aspect of the care. And so my question was why? I looked at these studies and said, why? Why are we not, even though we know it's important, why are we not studying it? So in the social sciences, what drives the research are conceptual frameworks. So I went to the conceptual frameworks, two of them, that are related to this topic, good death and end-of-life care. And we'll take a look at both of these. This is a little bit busy, but I'm going to walk you through it, I promise. So this is the good death conceptual framework by Emmanuel and Emmanuel. And if you just focus on the yellow boxes, you can see it includes information on the fixed characteristics. So these are things you can't change. The characteristics of the patient, their age, their gender, et cetera, and the stage of their disease. Modifiable dimensions, so these are things like physical symptoms, psychological, economic, and it includes spirituality. This is the care system, both formal and informal, so family as well as hospital and clinical care. And then this is the overall outcome, which is the experience of dying that families have. And what you see is in this very complex system, spirituality is right in the center. Similarly, with this model of end-of-life care by our nursing colleagues, Nolan and Mock, you can see that spirituality again appears right in the middle among psychological, physical, and functional domains. And again, it's a very complex system, but we understand that these are interdependent variables and it's necessary. Despite that understanding, the research is rare. So, I mean, we just heard from Dr. Barrere about research that's in its pilot stages. Full-fledged studies of this sort are uncommon, and I would say that the reason why they're rare is because we don't have a full understanding of what spirituality is. So I undertook this study to get at that. That's the purpose of this. And in order to do that, I wanted to hear from the target population, the people who are actually experiencing spirituality, they're having a spiritual experience at the end of life. And so these are the purposes: to understand the adults' perspectives of spirituality at end of life, and to have those folks that are actually living the experience tell us as researchers what it is that they want and need, the direction our research to take. So obviously the best way to hear directly from patients is to do qualitative research. You sit down, you talk to people, you hear what they have to say. The downside of qualitative research is that it's a non-experimental design, and so it really limits generalizability. So one way to overcome that a little bit, to mitigate slightly, is to do what's called a meta-summary. So you take all the qualitative studies in an area, which are typically small, and you aggregate them. So you aggregate the data, and then while the limitations of a non-experimental design remain, you do indeed have a more substantive data set because you have a much larger sample now to draw your themes from. So that's what I did. The inclusion criteria for the studies, for the group of qualitative studies that I identified, were that they were English language, that they were qualitative in design, obviously, that they were focused on a spiritual experience of adults at end of life, and that the write-up, the document, included either author-generated themes or the participant quotations, because the participant quotations is now the new data set for analysis for this study. These are the databases that were searched across the top. I'm sorry, it's very hard with this up above. And those were the keywords that were included in the searches. And the search yielded 11 articles total that were included. And in the interest of time, as much as I love methodology, and I'd love to share with you the process of doing a meta-summary, it's all available in the published study. So you can read about it if you're interested. But I would really like to use my time, as I said, for us to hear from the patients. So I'm just going to give you a summary of I'm going to jump to the results. I'll give you a bit of a summary here, and then we'll get to what folks had to say. So in the 11 articles, we had 5 countries represented. We also had patients who were at home, in hospice, or in the hospital. They had a variety of diagnoses. Most people had some form of cancer. Other diagnoses represented were cardiac disease, AIDS, and ALS. The samples on the individual studies were small, as you would expect. They ranged from 1 to 44, which is characteristic of a qualitative study. But look what happened when we took it in aggregate. 217 participants. All of a sudden, we have something to talk about. And so this was a great experience for me, I must admit. What we did, those 217 people, the quotes that we were able to draw from the papers, there were 89 themes that they expressed. When we took out the redundancies, anything that overlapped, we were left with 56 themes, and then we categorized, I say we, it was me, all by myself, in a very stormy winter. So I'm in favor of snowstorms because it helps me to focus and stay home and get my work done. So
you had a lot of time this year.
I did, indeed. It was a very productive year for my scholarship. So anyway, we were in the themes categorized into spiritual despair. And you may have noticed that wasn't mentioned in the last study. I'm not picking on you. I'm just wanting to say that the state of the research is not as well developed as we would like, as our patients would like. So there was spiritual despair, spiritual work, and spiritual well-being. And then there was these other 7 themes that didn't fit. What the heck were they? And again, after going out and shoveling for an hour, it came to me. These were the conditions necessary to do the work. So you'll see all of this in more detail as we go. So this is the categories broken down. So there's an overarching theme of a spectrum of spiritual health. There's not spirituality, spiritual health, one entity, but rather an entire spectrum that includes spiritual despair, spiritual work, and spiritual well-being. within despair, you can see in each of these columns, there are categories. So there's alienation, loss of self, and dissonance in despair. The work is categorized as forgiveness, self-exploration, or search for balance. And then the well-being we heard about. Look at this. The patients told us what Dr. Barrere just told us. That's nice to see. Connection, self-actualization, and consonance. So this is just an example of how they're broken down. What I would prefer to do is to read you the quotes rather than to slog through. And so I have quotes for each of the thematic sections. I want to first show you that I lit a candle here because we're going to be hearing from 217 people who were in the final weeks and months of their lives, and they chose to share very intimate stories about their feelings about spirituality. And all of these people are now deceased, and I'm acting as their voice. So this candle represents and recognizes their contribution to this study. The other thing that I'm going to do, just to frame the words, because I think these are real gems for us. So I'm going to ring a bell before and after each quote, so that way it just gives us a space for what these folks are saying to us. This is despair, feelings of abandonment. When they know you've got cancer, you become secondary. They all shy away from you. They don't have a clue how to talk to you. And you can feel it just in their body motions as they're coming to you, that they don't want to say anything. People that I was really depending on for support don't even come over. And it really hurt. For the work forgiveness, there's two quotes. I'm getting closer to my sister. It's something that's come out of this that wouldn't have happened. We're making efforts which we hadn't bothered before. This is a gentleman talking about his son. About 12 months ago, we had a going out. You know, he blasted the hell out of me for no reason whatsoever. So I told him where to go, and away he went. And the oldest bloke rang him up and told him I had cancer and was in the hospital. So then he rang me up and apologized over the phone, and I accepted it. That's one good thing that's come out of the cancer, you know. You don't want to argue with your family. And the well-being connection? Well, I think cancer brings people together because you sort of have more openness from people. It helps you relate to other people. It means, you know, we're all spiritual people, whatever words you want to use, and we're all here for different reasons, but we're all part of the same spirit, I suppose. You might call it God or universe or whatever it is you talk about. And I think that it makes you realize there's a bond. This is loss of self, injustice. I wondered what I'd done, why it happened, thinking maybe I've done something, but what? If only I knew. The higher being, God, if he's so good, why did he let this happen to me? When you see all these bank robbers and murderers going round, they seem to get away with things. I've not done anything like that. Why should I get it? It's hard to explain how you really feel. It's just, you're down, you're out, you're useless. This is self-exploration, discovering self. I was never like this before. Ooh, I wouldn't say boo to a goose. I was so conscious of not upsetting people and really sort of going out of my way to not upset anything. Not anymore. Life is too short. You can't afford to do it. So that's a confidence I found. I was too busy to find my real self before. I was muddling on day by day until I was seriously sick. Paradoxically, my mind was never as clear as now. This is self-actualization, self-love. I think the big thing we have to work on, the thing I really had to work on, was my self-esteem. Loving myself enough to know that I know what's right for me. With love, there's no more fear. When you finally love yourself, it frees you and opens you up. This is despair, discord. Maybe this is God turning around and saying, I'm going to get you back because I've not always been a lily-white guy. It's very hard. Where's it all going to end? It's just been right down that slippery slope. This is the spiritual work, search for balance. It's not wonderful, but I can cope with it. I'm still at home, I'm with my family. I know they still want me here, and I can be of some help to them looking after the grandchildren. It's a good enough life. It's still worth living for me. And this is the well-being harmony. I'm at peace. Father comes in and gives me Holy Communion. I have my calm. My body is decaying, but my spirit is being reborn. I'm eager to have a new life. So these are the 7 themes that I was telling you didn't fit into the categories. These are the conditions necessary to do the spiritual work. And I think it's important to be aware of these as both researchers and practitioners, because we can say, oh, this person has a deficiency and needs to be brought up to speed in a certain area. But if they don't have these other parts of their lives balanced, they are not going to be able to do the spiritual work necessary. So just to summarize, each of the qualitative studies, in effect, have become an archive of the testimonies of these folks. And the emotion, the sentiment, the wisdom of the participants, in my opinion, remained apparent, even though it was a secondary analysis of their data. The thematic analyses of these perspectives demonstrates that there's a spectrum of spiritual health, and that it's possible to move along that spectrum with work. The existential questions about the human condition can be ignored during many phases of life. That's what we do most days. But when they're brought into sharp acuity at the end of life, there's no longer avoiding these questions. And for those for whom the existential questions remain unanswered, the end of life can reverberate discordantly with anguish and despair. But for those who can use ritual or belief, it's possible to achieve spiritual well-being. And then end of life can be recognized as an opportunity, as an active time for accelerated growth, clearly requiring courage and grace and passion, and offering the opportunity to be transformed for both the patient and the family. Thank you. I'd like to acknowledge my teachers. Roshi Joan Halifax is at Upaya Center, Frank Ostaseski, Dr. Ruth McCorkle at Yale, and of course all of my patients and their families. And if you're interested in reading about the full methodology, it's available in this citation.
Hello, welcome. My name's Tami. It's nice to see so many people here today. I wasn't sure what the community was going to think of spirituality, meditation, and health, but to me it's a topic that's really important, and I've been working with the students that I'm involved with on campus to try to get them to understand that this is part of who they are as they evolve as adults and go off into the community. Using this is a form of wellness and preventative maintenance in anything they do. So my title is Assistant Athletic Director, Fitness and Wellness. This is definitely the wellness component. People see fitness, the yoga, as a fitness way of life, like a way to move forward and be healthy. But it goes way deeper than that. It's the body, mind, and spirit, as we've been talking about. So it's been my mission on campus to sort of start weaving in these ideas and these threads. So what I'm going to present is some of the things that we are doing on the campus, currently with students, with other programs, just sharing that with you so you have an idea. Some of the courses that we're doing, also some outreach, so some of the community outreach we've done. In addition, I have just a couple of resources. So mine is the not very resource-ish topic that we're going to talk today. This is my own stuff, right? This is what I do. Mine is all that talking with the students and getting feedback. But I did send out a little survey so I can present some information so you can hear a little bit from them, and we have some quotes to share. So what I thought was important is that you realize that the whole idea of meditation is tied into the idea of yoga. Because a yoga isn't essentially the movement. That's what we think of in the US. We think of yoga as the movement, the asana, getting on the mat and moving and bending into pretzels. And that's part of it, but really it's an eightfold path. That's what yoga is. And the meditation part is the seventh element of that piece. So essentially all the other limbs and all the other things that you practice in yoga prepare you for the meditation stage, which is really part of enlightenment, whatever you want enlightenment to be. Enlightenment of the spirituality piece of outer, bigger universe, or enlightenment with what is inside of yourself, which is a lot of the times how I like to present it to my students. We don't have to think out here, we can start here. So what is inside of you is what you need to start bringing out. But the yoga piece sort of takes a bigger press than the actual meditation part. And it was already mentioned earlier that there's that link. Maybe when you're doing yoga, you tend to meditate or think about it more. And essentially, that's considered a moving meditation. There are so many types of meditation out there. We're not even going to talk about that. We haven't even touched on that, right? There's a million forms. But moving meditation is huge. And so if you're doing something with attention and awareness, with the presence of breath, you are meditating. That's all it is. So whether you're doing your yoga practice, washing your dishes, walking your dog, or sitting down quietly in front of a candle, all of that is part of meditation. So I just wanted to sort of frame that a little bit. And these are just some benefits that we've been promoting with our students. So I personally wish that this was something that I started in college, which is why, as a mom and as a person who's an advocate for our students, why I think it's important. If I had these tools, I feel like I would have been in a better place. If I had the opportunity to sit down and be quiet with myself for a few minutes, I might have gotten a little bit farther, or at least done a little better than I wanted to in college, right? I was all over the place, and I think many of us are. So meditation is really hard because we have become a society that's super good at multitasking. All we do is add more, and we can simultaneously do things all the time. So what kind of quality are we giving to any one thing? And so essentially this tool, this meditation, this like going in, is that one little tool that can help us quiet all the multitasking and be able to do one thing, even if it's for 1 minute. We have lost that art, all of us. We are all guilty of that. On our cell phone, on our laptop, driving our cars, probably, doing all the things that we do at one time, having a conversation, many, many things. And so for me as a fitness professional, whether I'm teaching yoga or whether I'm teaching spinning, no matter what I am teaching it with mindfulness, because even when people are coming to fitness, they have their task list going. So they sit on the spinning bike or they sit on the yoga mat and they go through the motions physically, but mentally they're grocery shopping, they're picking up their kids. Oh my gosh, I forgot to do this, I forgot to all this one, I need to. They're not present. So essentially, we need to work on having these tools, and if we can give them to our students here in college, and it can become like a little bit of a habit, even if it's a few times a week, as we talked about, that can just grow, and that will really help serve them when times in their life aren't as easy, and they're really going to need something, and that ability to sort of look inside and know that the answers sit there. So there's many reasons why we want meditation. I think what's interesting for me as a fitness professional, and all of the journals and research journals that I get, 90% of them are focusing on the benefits of meditation. So this is what our industry, or I should say my industry, is working on. Not so much the benefits of high intensity training, which we know is there. People want to lose weight, so we want to burn calories, et cetera, but really they're doing research on all levels with how this meditation fits in with the whole wellness aspect and why it's so important. So one of the courses that we have on campus is a physical education class. So it's a 1-credit class that the students can take. It's called Yoga Foundation and Fundamentals. So I started this class because yoga is seen as movement, and I wanted our students to know that it was way more than that. So in this course, we talk about, what does it mean to do yoga? What is meditation? We practice different meditation aspects, whether it's sitting and using breath awareness, whether it's using a guided imagery, whether it's my voice, whether a recording. We do yoga nidra. If anybody knows what yoga nidra is, it's definitely the yogic sleep. We talked about sleeping. That is considered a yogic nap, but it's deeply entrenched in your subconscious. It's sort of like a power nap where you're guiding yourself through your body. And if you're really practicing it, you layer in this item called a sankalpa, which is your true desire. And essentially you're planting the seed. So I like to think of it, or if I'm describing it, it's like The Secret. If you think about it, if you throw it out there, it's going to happen. Well, a sankalpa is a secret that you plant inside yourself. And so eventually it hopefully manifests. And usually it takes 3, 6, 18 months for something to really to work. So we're practicing all of these, and these are new ideas for our students. And not only are we using the meditation piece in the class, but then we're actually literally breaking down some of the yoga components as well as, looking at safety. And people are flinging themselves around on the mat. And I don't know if you heard the press a little while back, but there was a gentleman who came out with a book, how yoga ruins your body and it's really bad for you. And it's fitness, it's movement. So anything that you do that's movement has the potential to cause harm in your body. As health professionals, I could walk down the street and trip, I could hurt myself in yoga, I could hurt myself hiking up the mountain. It doesn't matter. It's something you're doing with your body. So the other piece of this is teaching them how to do some of the movements correctly and what to think about to prevent the injuries down the road, especially if they're going to a class that is maybe flinging them around on the mat and not giving them as much of the here's how you take care of yourself piece. So this is one item that students can take advantage of. So we also have a reflective hike to yoga program, which we've been doing for a few semesters. It's a collaborative program. Vince Contrucci does the hiking of the giant, picking the trails. Terry Johnson usually leads our meditation for us at the beginning. I do the yoga piece somewhere along the way, and it's usually just a small amount. And we've added a guest theme. So what we're trying to do, and these are just some past themes that we have. Yesterday we did our first spring one, and it was failure as a key to success. So we're just sort of threading in the idea that we can be mindful of the movement, we can have fun, we can be outdoors, and at the same time, it can have an element of learning about ourselves or some other experiences. So it's been really fun. It is not for credit. We get a variety of people, faculty, staff, students. Yesterday, even though it was drizzly and rainy, 5 minutes before 4:30, we still had 12 students come out, which was a pretty big success, I thought, and we had a lot of fun. So I welcome you all. The next one is next Thursday on the 11th, and that is Reverence for Life. I believe somebody here might be doing that for us, Professor Page. Another element is I've been very fortunate to be partnering with ASI, with the Schweitzer Institute, in some of their trips. And some of the places that I've been able to go and work with the community is in Guatemala, Nicaragua, and Barbados. And so we've been using yoga, breath work, and I guess we call it yoga, although it's mostly breath work and some meditation, as a form of self-care. And many of the societies that we are working with, the Mayan women in Guatemala don't really take time out in their day to take care of themselves because they are still gathering firewood, cooking on open pit flames, taking care of all the children, working some type of side job, and self-care is not part of their life. So it's the idea of if you sat for 1 minute in the presence of your breath and focused how that could change your aspect on what you are doing, your quality of the day, your thoughts. And so we've just been adding just a little bit of this, and it's been really fun. So we've gone 3 times to Guatemala to 2 different areas. Every time we go, all we hear is more people want the yoga. So they think of it as yoga, right? So that's very Western, which is exciting, but really it's, breath work and some meditation. And we've done a variety. We've done some yoga nidra, we've done some guided imagery, we've done just, awareness of breath. And it's really interesting to see in Nicaragua, for example, after working with the moms in the little village of Leon, at the end of the week, they're like, oh my gosh, I've never slept better. My back doesn't hurt. This is the best week of my life. And I had to say, oh my gosh, I did not get the yoga fairy dust out and spread it all on you and cure you. Like, that's not what happened here. But you took care of yourself. You came together as a community. You sat in the presence of your breath, and you probably slept better just because you had more oxygen in your body. So that is what really did the work, you and the community, not so much the yoga. But we sometimes need a vehicle to make that happen. So it's been really wonderful. And then Barbados was a professional development retreat for women that were slated with domestic violence or the habit of in their community of domestic violence. So we were sort of giving them some prevention. And we did a lot of yoga. We did loving kindness meditations. We did some various things to use as tools for them to help prepare themselves and to help support what they were about to face or were facing in their lives. Terry Johnson did global conservationism as a 301 and invited me along. And so I felt like I had to be an active participant in her group. So my role was actually taking care of our students, which was really lovely because when I've traveled abroad, I've worked with the communities. This was directly with our students. So we did yoga on the beach in Costa Rica. We did yoga nidra in various places, and we talked about it, we dialogued about it, and it was about 20 students, and it was just a really nice, intimate group of students that we had for 10 days, and we sort of explored this, and they asked me to, talk them to bed at night. They would say, can you do yoga nidra as we fall asleep? And so it was just really fun to see how open they were. And I guess for me, that's what's exciting, to see their, request for it. It's not like, oh, she's asking me to do this again, where my own children would do that. It was, like, wow, can you do this again? It was really fun. I think they're getting something out of it. They're not sure why. It is very hard to make this tangible and to see the actual research or the data to put it in those words. It's very much a feeling, but that feeling is there for whatever it's worth. And then I'm in the process right now of teaching a 301, Can Yoga Change the World? We're using all of these elements that I've been talking about as a tool for self-care, again, to help these students. There are a few that are nurses, diagnostic imaging majors. It is not only going to be a tool for them, but a tool that they can use with their patients to be able to control their emotions, their thoughts, their anxiety, their depression through breath, through focus, through what they hold inside is going to be really, really, really crucial as they move forward. And so we're doing lots of things. One of their assignments every week is they get a different meditation, all different. So last week it was just mindfulness, and they had to pay attention to their food, and they had to journal on it. They've done loving kindness meditation. They've done just awareness of breath, and they're now practicing the art of sankalpa, and we'll be doing a lot of yoga nidra while we're away because we actually go to Bali with this class, which is the other really fun piece. So we'll be staying at a yoga retreat center, and there will be yoga every morning and meditation every day, and then a group discussion about all of that, a theme each day when we're there. So it really is, although we're going to do some service, it's a self-care trip. And I think that's really important. Whether we realize it or not, our students have so many pressures. I see it as well working in the athletic department. We have the student athlete, which is a student, but then you add the other element of the job. Many of them are paid. Their tuition is paid, so they are paid to come, and the pressures are huge. So giving them some vehicle where they could just be themselves is really important. And the yoga and the meditation and these little elements are the places where they don't have to be the best. They don't have to be perfect. They're not graded on it. And they're really, really enjoying that freedom. So I know grades are really important. I'm not saying they're not. But there is really a lot to be said for doing something just because you can, not because someone's expecting you to or you have to perform. And then one other item that we're working on, and we did it during exam week last fall. It wasn't huge. I don't think people knew about it, but we called it the breathing room. And we had it on all 3 campuses. We just took our studios and we set it up with not beautiful flames, but battery LED lights. We had lovely music. We had tea that was there. We had little handouts that had a few different breathing and meditation practices, and it was just an opportunity for people to come and sit, whether they were breathing, whether they were moving, whether they were actually meditating. We just called it the breathing room, and we just had a facilitator in case people were lost. We did it on all the campuses, and we will do it again. So I encourage you to, if you are teaching, to promote this with your students. There will be a schedule. It'll come up, and it'll just be a place for them to take a 5-minute study break or an hour study break, whatever they need, and they're close to the libraries, the study rooms. So please, that's something that we're trying to build for them, that little space. Going along with this, in our beautiful new medical school, they have a space, a reflection/meditation room. So that is really lovely that they built that in and are encouraging their students to take the opportunity to go in, whether it's by themselves or whether we get to schedule it a little bit, I'm not sure. But it's just nice to have that environment. I think that's, to me, what a yoga mat symbolizes, rolling out the space, and you know that you shed everything else and your job is to just do this and just be with you. I think that coming into the breathing room or going into that reflection room is going to be the same thing. I can let go of everything else for 5 minutes while I'm in this room. I don't need to hold it, and it feels really good to get lighter. Many of our students need to lighten the load. So academically, what I wanted to throw out there is I had gone to a conference, and there's so much amazing stuff going on out there in higher education. It's not just in the fitness world, it's not just in health profession, it's in higher ed. So in Amherst College, they have actually an institute, the Association for Contemplative Mind and Higher Education. And they are doing so much threading this in to their curriculum and their courses. So this is just a little blurb. Maybe you want to write the website down. But I heard one of the directors speak, and it's just really interesting to hear what he had to say. Kripalu is an institute in I believe Lenox, Mass. And they have an Institute for Extraordinary Living. So working with Harvard Medical School, they are doing research on yoga in schools, yoga in healthcare, yoga in PTSD. They're trying to put the actual, verbiage and the scientific research behind it, and often working with brainwaves now, which is interesting. And Stephen Cope is the director of that. So I'm hoping somebody wants to collaborate, because I'd love to get us in there. And then one other place, education, is UCLA has a mindfulness and research center as well. So just some little places for you to see what other universities and higher education are doing and how they're tying in mindfulness, awareness, meditation. So for our students, just quickly, I just threw out some basic questions. How often do you meditate? Do you meditate when you're stressed? Does meditation make you feel better? What is the hardest part? Do you find it easier to follow on your own with an instructor, with a recording? And when did you start? So these were just some students that I know that I had worked with in the past. I sent it out to about 75 students a few weeks ago and got about 25 responses, which isn't too bad. So a few times a week is mostly what we're looking at, which isn't, unusual. That's sort of what I figured, if that. Meditation is one of the best tools I found to feel better. It always gives me a shift in the perspective and allows me to regroup. Even I am out and about and I need a quick pick-me-up. I practice walking meditation just to focus on my breath and be aware of my surroundings. So these are quotes from their paper that they sent back to me. Most of them meditate when they're stressed. So clearly there is something that they are tying together, which is good. There is a tool. It is not just medication. It is not just, abusing yourself. It is actually sitting quietly and thinking about a way to deal with it, which is awesome. And I won't read all of the quotes, but hopefully you'll have a chance to look through. And it generally makes people feel better. But I think what's nice about using any type of meditation or mindfulness is it never makes people feel worse. So you can't lose if you're prescribing it, right? When you're working with someone, it's not going to hurt somebody. And I think that that's one of the things we have to be careful of, right? Doing no harm. In healthcare, you all know that. So if I go to Guatemala and tell them to sit quietly, it might not make their life better, but it's not going to make them worse when I leave. And that's really important. I thought that was an important question to add. The hardest part, which again I find interesting, and they said facing unsettling parts of myself was high, and also quieting the self and mind. That's awesome, because to me the hardest part is carving out the time. So if our students are saying the hardest part is quieting the mind, that's what meditation is, and that hardly ever gets easier. It takes forever to make that practice easier, right? So they're already starting. I feel like they're way ahead of the game, which is awesome. and just about following with an instructor or an audio. And most of them started meditating, as you can see, within the last few years. And again, many of these were students that I've worked with in some type of a course, or my yoga instructors. So they have, sort of ventured into it that way. And this was actually what somebody wrote on their paper that they sent in, which was so beautiful, and referencing, Tao Te Ching, and it was just really beautiful that they took the time to really forward us this information and how important it is in their lives. And I believe this is actually from a law student, but I won't name a name. So again, these are many ways that people can use the campus to start meditating. So if you are on this campus, I encourage you to encourage your students to reach out. If they're unsure, if this doesn't work for them and they need to find another way, just have them contact me, whether I'm doing it or they're going to a class. There's many things that we can offer. We work with RAs. I've done programs with the RAs on, having more meditation in their life, but also just areas of self-care. We've worked with some of the RAs when they've done programs for women's strength and compassion, and we've done, girl power yoga, warrior yoga, you name it, we've done it. But we always have a meditation piece and contemplative piece that we add in there. This is our hike to yoga schedule in case you're interested, and you always have to promote. And then we just have the beautiful lotus flower coming out of the mud, which I just wanted to add in there. My students had to do presentations on yoga topics, and this was part of someone's presentation, and I'm always really in awe at what our students can find out there in the world. And this was just a lovely finish to her presentation, so I added it to mine. And if you don't know the symbology or the symbolism of the lotus, it is this gorgeous flower that grows out of the mud, literally the mud. And so many of us are lotuses, right? There's a lot of mud down there, and we have to find the blossom and the bloom to come up out of that. And that's what life is, right? It's a practice of staying beautiful in the mud. And so hopefully our students can start to venture into that a little bit more. So thank you for allowing me to present with such lovely, amazing research topics.
Anybody have any questions or comments?
I was going to say, I don't have a question, but I just wanted to comment. The whole thing was really relevant in multiple parts because I actually have been doing yoga every week since the fall semester here, which is really awesome because they're free here and you don't have to go out of your way. It's right on campus. And I think every student sort of ties a theme to each year of their college career. And I feel like this has been my healthiest year all around. And a lot of it, not just physically because I've taken the time to do more of that, but a lot of it is all about the mind. And the yoga was a big part of it because I've been doing iron yoga, and that's, it gives you a physical challenge. But it's made me take the time to meditate. And as you said, it's even if I'm in the shower and I'm taking like a hot shower and I'm just thinking about nothing but just enjoying the moment, which is really hard for me because there's a lot on our minds. So I think it's really awesome that there are so many opportunities for students, because when you think yoga, you just think, oh, yeah, it works. But like to actually do it and to see like it has made such a change, and as an OT student, then to be able to see how I can use it with clients. I'm all into whatever you do with your clients. I think you should sort of try yourself too. And so I just think it's awesome. And that's why I actually did yoga. We were required for one of our classes to go and do either, what was it? Tai Chi, yoga, like some sort of alternative, and that's how I started it. And so I just wanted to say, I think as a student, it's awesome.
It's wonderful.
Yay.
So, Tami, have you all tried to work with human resources in terms of opening up more yoga and meditation for faculty and staff too? For example, in your rooms during final, can we use them?
Anyone can use them. So any of our programs that we run are always open to everybody. They're always on my queue. All the classes are on my queue. It's just a matter of getting the faculty and staff to be okay hanging out with the students on that time. And I think there's a space. So for me personally, I don't work out where I work, right? I have a gym membership because this is my job, right? So I think some of us need that space. But if they feel comfortable, they are never not invited. Everything is always open to them. And in the summertime, we do usually run a summer yoga series that we promote at the little health fair that we do. And the breathing room is definitely, we would never kick anyone out of our room. So it doesn't matter who you are, if you're coming to, Yeah, yeah. Well, that too, but we would love for more faculty and staff to be a part of all of that. So maybe we'll just try to do a better advertising job. And I know HR is working on their website to promote things, and they're going to be adding more of our information. But I do actually have to say I have a lot of faculty and staff that have been doing the hike to yoga, which has been awesome.
Well, I've done Tai Chi for quite a few years, but to have that available here, my time out now is to go for a walk, you know, and clear and do it that way, and do a lot of moving meditation. But to have a space, you know, is really important.
Okay, please come to the breathing room. Okay.
So I just had a question because, most religious traditions in the world have some kind of meditative, whether they call it meditation or contemplation or prayer. And this is really for any of the three of you. Have you worked with either hospital chaplains or Tami, maybe campus ministry here, to make that connection with people who might be doing meditation as part of a religious tradition, or who might be interested in learning that it is part of their religious tradition, that they might not have run into that before?
So, well, I'll just answer briefly. So I actually haven't yet, and I'm going to say why I haven't, and I would love to, but I feel like there's also that element where people say yoga is a religion, and I don't want them to think that. So I've been really trying to make it clear that there is no religious attachment to this. This is about you, but there are many ways that we can tie it in, of course, and so I would love an opportunity for that to happen, but I've just been very careful not to make people think that I'm, because we have statues and Buddhas and chanting that comes along, and so people don't know what any of that means. I'm very careful in my classes. If we put our hands together, I always say, you're not praying to me, you're not praying to a god, it's a mudra, it's a lock or a seal, right? I describe it so they don't think that there is that religious element to it. It can be very religious if you want it to be, right? Any of it, and very spiritual, but it also cannot. So I'm careful to meet people where they are, if that makes sense, and not to push that end on somebody. So that's why I haven't. But if somebody sitting here wants to collaborate on any of that, I will. And so I'll pass it along.
So in clinical practice, the rule is always you meet the patient wherever they are. So for people who have a religious practice, it's always it's often helpful to invite people to go home, so to speak, to find their way back to what was meaningful to them at some point in their life. And if it was helpful to them at some point, even though they may have drifted, then it can be a pathway back. What you find, if speaking to people who know more about this than I do, but that so many of the world religions have quite a few commonalities, and so it's any path is a path home.
I guess similarly, as you heard in my presentation, we didn't work with a specific chaplain, but we did respect, as you were mentioning, as patients, you take them from where they're at, you respect the religious aspect, and many of them did have comments, especially in the qualitative study, that I didn't share the entire study of that perspective, but many of them were religious, some were not, but it was all about meaning and what's meaningful to life. And as you heard, the scale that we use, the spirituality scale, certainly respected the various religions. It respected every individual, whether they were religious or not, because they were all spiritual beings.
A couple of years ago, I had some surgery down at NYU in Manhattan. And prior to it, I became aware of a program called Prepare for Surgery, Heal Faster. And I was really an active participant in it, preparing before. And NYU is connected with that program, where the anesthesiologist, I presented some things to say, and he did. And then afterwards, they connected with me as well. I was encouraged to have a support community out there, and the whole program worked really well for me. I connected very much with the work and well-being columns that you presented here. So I'm wondering, are you aware of that program, and how, if at all, do you see that program fitting in with what you were talking about here today?
Sure. So it's a terrific program, and they're accruing data nationally on it. It's present in only a handful of medical centers nationwide, but the outcomes are absolutely remarkable. As their title implies, people are healing faster and healing with many less complications. So there's an economic impact to it, and usually that's what drives programs in medicines. If it's economically feasible, then it can be rolled out. So there's a drive towards implementing more and more of these types of activities, but it's not widespread now. I'm so pleased for you that you had a positive experience
Very
with
much
that.
so.
Yeah, that's great.
Our whole family did, really.
Question for Cynthia. In your study, relatively speaking, how much was there improvement? Was this, because I don't know what the scales imply, was this a lot of improvement or not? And secondly, did you actually assess the people who didn't complete the program? Because you don't have a control group, so it's hard to know if this is a placebo effect. And they just like working with you and that makes them feel good. But the people who didn't go through the meditation, what were their scores? And I would encourage you the next time to make sure you do include a control group.
Yeah, that's it, right. The larger study that I spoke about does have those components. As we improve and look ahead for a larger amount, the control group will be involved. And looking at the persons that didn't finish is interesting to look at. We just queried some of them, just anecdotally. I think there were 5 or 6, I have to refer back to the article, I think there were 5 or 6 who didn't finish because they had cardiac issues that did occur, surgical, and they were not physically able to continue in the study. Others, a few were, maybe 3 or 4 didn't do it because they just didn't have the time, didn't want to take the time to meditate or try it, which was fine, that was honest. It's like I guess I look at it, it's like any physical medication. If a person is taking an antibiotic for a particular bacterial infection, it might work for many and it won't work for all. So other things have to be tried. So these interventions aren't a one-size-fits-all. So there were various reasons that they didn't. We didn't query every single one of them, but there were specific reasons that some did not finish. I think a control group is a good idea, and that's what will be, if we carry on the next larger component, that will be part of it.
You just follow up, was there improvement a lot or a little? I mean, again, I don't know what the scale means.
Well, I had shown that one, a lot, that's kind of a relative question. The 2 areas of significance plus the spirituality score going up, I don't recall the exact numbers.
Effect size?
Oh, I don't remember this. I'd have to look at refer back to the data at this point. It was in 2010. I don't recall the specific numbers. I would say it was just a small to moderate increase because it was a small number in the sample. 46 in that particular study I presented wasn't really a large sample. It was 27 completing the entire study. So I wouldn't say that it wasn't a huge increase. It was significant, yes.
I have a question about the spirituality at the end of life study that you did. For those who expressed spiritual despair, that theme, what were some of the main things that helped them through that? Did they talk about that at all in the studies that you looked at, or just as like a healthcare provider, just helping those people through that? Like, what would be the most helpful thing for them?
So in terms of what these 11 studies did, an intervention, it was not part of it. They were all qualitative studies, just assessing what the patients were experiencing at that time. But I will speak as a practitioner in terms of what I would do as an intervention in the clinical setting. And when I worked in palliative care, worked with an entire team of people that included, I was a psycho-oncologist, but there was nursing, medicine, psychology, social work, and chaplainry involved, as well as all of the art therapies, music, visual art and literary art available to people. And again, in a way of meeting people where they were during these incredibly intense times in their lives, letting them know what's available and seeing if there was some way to get a hook, some way to get them to express what their concerns were, and then to work with them on that, ideally as a family unit or at least as a dyad with another person. But if that wasn't possible, then working with them in whatever their environment was. For some of these, there's some, really isolated folks living in rural parts of the country that are disconnected from their family, but they have a tremendous connection to nature, and it's very, very meaningful to them. So it's just finding out what is the salient thing for the person in front of you, and working with them, finding the avenue into that to help them. And I will say it has been my experience that I feel like the end of life is this really accelerated time, accelerated opportunity for growth, and just about everyone visibly arrives in a place before they die, arrives in the place that they need to be in order to die. It almost makes you think that they can't die until they have arrived. And while it may not be obvious to all of us and may not even be obvious to their family members, over time I've grown confident that the person dying knows what needs to be done and gets there. And our job is to help them and not get in their way, and whenever possible, remove the obstructions.
What are the scientific differences between this meditation through yoga and whatnot and just taking a nap? Like many times, and people will advocate, have a nap where you get in the zone of, you free your mind, you zone out for a little bit, and then you come back and you're refreshed.
Sure, that's a great question, and naps are beautiful and wonderful. I will say that in the last 10 years now, there's a developing neuroscience of meditation and of sleep, and they're very different when we look at the brains, when we map the brains of meditators, non-meditators, and sleeping folks. Very different parts of the brains are lighting up. The different parts of the brains are activated. So again, it was interesting to me to hear about this meditative practice that Dr. Barrere presented, where the emphasis was on relaxation. Actually, there's many forms of meditation, and some would even say that you have not achieved a meditative state until the brain is highly activated. So it's heightened awareness. Sleep is not heightened awareness, right? So you need to relax in order to expand the awareness. And when you look at meditators under an fMRI machine, under a brain scan machine, it's lit up. It looks like a Christmas tree. It's incredible activation. And really what we're seeing is this incredible syllogism. There's connections. It increases the connectivity across the areas of the brain. It's very exciting work. It's all emerging. There's nothing definitive yet, but it's happening. If you're interested, I would recommend reading work by Richard Davidson at University of Wisconsin-Madison. He's spearheading a lot of these initiatives, but there's a lot of people working in the field now.
After my nap, I'll read it. Thank you.
Sure.
I have a couple of questions. As a qualitative researcher, I was really fascinated by your method and understand the painstaking work of going through and looking for things. And I understand that how it comes to you in the most unusual places. And I was just really touched by both of you, actually all three of you were really talking about the voices of the participants, because I think that's so powerful to know what it is that people experience. But I think one of the things, I also appreciated the idea of the spectrum of spiritual health. That I think that sometimes people, when they hear the word spirituality, shut down and don't, that it connotes religious aspects, or just, I'm not a spiritual person, I'm a non-religious person. And I just was thinking about my mother, who my father passed away recently, and she is avidly non-spiritual, but it's so interesting when I talk to her on the phone, there are these little things, these little practices that she's doing now that she doesn't recognize. She won't say that they're spiritual, but lighting a candle, keeping a candle lit, or taking time to just lie down on the bed in the middle of the day. These are practices she never did before. And I was sort of laughing with her and saying, those are spiritual practices. And she's, no, they're really not. But in my last conversation with her just the other day, she was starting to recognize that maybe they are, in fact. And so I think it's very interesting that people's own process in terms of when, and the words that they choose to use or not use. And so, Tami, I appreciate your sensitivity about the language that you use and let people sort of figure it out for themselves.
It's also hard for me, so say I was in Guatemala or Nicaragua, you have the language, so things don't translate well all the time, and also they are, especially in those communities, their religion is super important, so you don't want to impose anything on them. When we were going to Nicaragua and David had said, hey, we're going to do yoga, who's interested? And they said, we can't do yoga, it's against our religion. So I was going in knowing that was here, and I was really careful not to use anything that would have seemed like it was, religious. And, even if it's spirituality, whatever we're calling it, because I didn't want them to go running. I wanted them to embrace the other pieces. I always say, as a teacher, first you give your students candy, and you get them to like you, and then you sneak in the vegetables. So, the spirituality is the vegetable. And if you think of the yoga world, it is. We give people the asana here in the U.S. because they want to move. They want to be physical. And then we start sneaking in the vegetables. We're just going to breathe for 5 minutes before we move. Okay. And so that's how we start getting them to buy into it. And then they're like, wow, there's something to this. Vegetables aren't so bad, But but in the beginning, you don't want them to run away. So you just give them what they think they're here for. So.
I think making it understandable makes sense as well on a spirituality scale. I think that's why it took off the way it did in the examples I shared with you. Very easy to understand, that would engage anyone to answer the questions.
That's right. What's meaningful.
So your students who were resisting, were they able to participate in the breathing and feel like, did they think they were doing yoga?
So when we were in Nicaragua with the ones that were like, no, it's religious, I would have never known if I hadn't heard that story ahead of time. They were very open when we got there, and we really just said, we're going to move and we're going to breathe, and we're just going to take time to be with ourselves, right, which we don't get. And the other piece that we found, it was really an amazing community experience that happened. So we would do it at a different woman's house every day, and we would get there and they would be laughing and joking, and we would have different little kids there. So, it was just this energy orb that just started to be creative that was just really amazing. And they didn't realize. So even, if we sat still and breathed, it was just breathing. And that was good, and breathing is good, and that's all it was, even if it really meant more than that. And so they weren't resistant to that. We just had a lot of fun, and it was fabulous. So.
I think your use of the word self-care, caring, taking time to care for yourself, presents it in a way maybe that also doesn't make people uncomfortable.
I mean, to me, that's what it is. My job is fitness, but the gym part is what people see as fitness. That's, again, the smallest little piece. It's how you take care of yourself in the relationships and in your, self-esteem, and, just taking time to be with yourself, which we don't want to see anything, we hide from it, so.
I was going to say, it's not even just because I say I go to do yoga, but that's, as you said, that's the commercial name for what I'm really going there to do. Because, for instance, with the napping, I'm not a napper. I don't feel good when I wake up from a nap, actually, halfway through the day. And, for instance, after I do yoga, I go straight into an hour-long spin class. And had I taken a nap before that spin class, I would have felt really groggy and just not good. But I'm in one of the deepest relaxation states right at the end of yoga. and yet I feel so energized and great afterwards because of that meditation piece. And you said doing the dishes, random things like that. I live alone this year, and people say all the time, that's got to be so lonely. And I say, really, when you occupy your mind with like good things, like you're really not alone. You're really thinking about a lot of things, and there's something there the whole time. So I think it's really, people find, whether they call it their religion or their spirituality or they're doing yoga or Tai Chi, it's just a cover name, I think, for what they're really getting out of it, which is why I think that it works for so many different people, because it's different for everyone. And everybody takes something different out of it. So when you say you're doing your time, that's different for everybody. So I think that's why it could work for, and whether that's the placebo effect or not, which really the placebo effect is the mind, and if it is a placebo effect, then great, it works. So
I'll take what you're taking.
Well, I have just something to mention. I was really impressed, as three of us had not really coordinated what we did at all. And I was just really impressed how we played off of what each other presented. So I thank you, both of you, for working with me.
Thank you.
Thank you.